Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. And you can also visit the playlist. In the playlist I have given all the topics in a systematic order so that it is very easy for the study. Anyhow, my dear friends, since last so many classes we have been discussing about autism spectrum disorder. In the autism spectrum disorder, the first disease that we have covered is autism, the real autism, and we have seen all the basics of autism, clinical features, core symptoms, the method of diagnosis, some of the differential diagnosis, treatment, management, etc. Now when we talk about autism spectrum disorders, there is another important disease which comes in the autism spectrum, so that is called as Asperger syndrome. Asperger syndrome. Not much has been discussed about this Asperger syndrome, but understanding this Asperger syndrome is also very, very important. Asperger syndrome in children may many of the time run unnoticed because it is not actually causing much impairment in the quality of the life of the baby. Okay, so this is actually a quite interesting disease, and many of us may also have some of the symptoms of Asperger syndrome that is left unnoticed even in our life also. And understanding about this Asperger syndrome helps to identify this problem in our child at the earliest, and we can do some of the corrective methods. Anyway, this is not much disturbing. This is not such a disease which has to be treated promptly. Like that, there is no such issues. But understanding this problem or knowing about this problem helps to understand the mentality of our child, and we can have a similar type of dealing with that particular child. Otherwise, the child may get isolated at times. Anyway, so in future 3 or 4 classes, we will try to understand this Asperger syndrome. Quite interesting. So what is this Asperger syndrome? Asperger syndrome is not actually a disease. Okay, so this is considered as a mild form of autism. This is considered as mild form of autism. So how the name Asperger is given? That is, this disorder is named after the German doctor Asperger, who first described the disease in 1944. Actually, he belongs to autism spectrum disorder family. That means his family members. There's a strong history of autism spectrum disorders. And he has noticed that although the other family members are not having autism, but the other members are having some of the symptoms which is related to mental and as well as social development. So they have got some social restrictions. Okay, so they have got some social restrictions, although they are not actually having full-fledged symptoms of autism. Language is good, but some social restriction is there. So this was noticed by this Asperger's when he is studying about this disease, and later in 1944 he named this particular problem as Asperger syndrome. Now there will be no or less eye contact, and they show their emotions at a very low level or not at all. This is the main problem with the Asperger syndrome. See, any adults or children with Asperger syndrome, they have got poor eye contact. That means it's not that there is no eye contact at all. Okay, so with the familiar faces, okay, with the faces they actually want, so they will have complete eye contact. But with others, with the strangers especially, or some other people which they don't like, when they talk, so they don't have a continuous eye contact. They don't have. They occasionally they will look into their eyes. Okay, so there will be no or less eye. Sometimes there is no eye contact at all. They are seeing somewhere in the wall, and then they are talking. So person is sitting in front of them, but they are looking at the wall and they are talking. Okay, but they are talking to this person, but they are looking at the wall. So there is no eye contact, or there may be less eye contact, and they show their emotions at very low level. When they are happy also, they will not show their much emotions, and when they are sad, then also they will not show much emotions. Even for a joke, they will laugh very less. Okay, and similarly for all the emotions, it may be angry, it may be frightening, or is caring, or it may be surprise. The emotion, the exhibition of the emotion is very, very less in such kind of children. So therefore this is quite interesting. So often we get such children and people in and around us. This is one part. Now, the other part of the Asperger syndrome is, but they can talk about hours together in the interested topics. It's not like that they cannot talk. They will talk very much. But if you give an area of interest to them, okay, if you give a choice of area of interest to them, so they can be talking on the same topic for hours together. It may be boring to the other. Suppose you met with a child and he is very interested in some of mm, the cartoon show, suppose. So about a particular cartoon, he can talk so many hours. Okay, hours together he can talk. He don't bother whether it is pleasing to the person who is sitting in front of me, whether he is listening or not. But he go on talking. He may not have 100% eye contact also, but he go on talking in a topic which is of his interest. This is one thing. Then another one is repetition. Repetition, suppose that means such children, so they have got some repetition behavior. See, repetition behavior is also seen in case of autism, but there the repetition behavior is something different because sensory block is there. So here there is no such kind of sensory block. Child is able to understand what you are talking. Child is able to appreciate what he is seeing. Okay, so visual and auditory sensory block or some other sensory block is not there, but still a sort of repetition will be seen here also, but it is not much dangerous. For example, suppose if there are so many roads to go to a particular target, suppose you want to go to a city or somewhere else, to a particular shop or mall, etc. There are so many roads are there, isn't it? So we have got 10 or 15 roads or 6 or 7 roads are there, and this child, what he will do is he always prefer the same route, although another route is quite nearer, okay, a less distance, but still he want to go with the same route which he is get habituated. So he want to go with the same road, or sometimes same dish. Sometimes you are going for a refreshment or outside hotels, etc., restaurants, etc. So where he always prefer the same dish, okay, always same dish. He is liking the same dish, and they eat, and same schedule. Schedule also they will not going to change. So 5 o'clock, early morning 5 o'clock, if he is getting habituated for that, definitely he will get up every day 5 o'clock. Okay, at 10 o'clock he will go into the bed. So they don't want to change their schedule. Okay, and also same place of sitting, even in the class, maybe in the home or some anywhere. So they want to prefer the same seat, corner seat or middle seat or front seat, whatever. So always they will sit in the same seat. So they will not exchange the seat. In normal kids, others usually we sometimes exchange the seat, isn't it? So sometimes we are sitting in the front, sometimes back, according to the situation. But these people, these kids are not like that. They prefer to sit on the same seat. If that seat is not available, they will be agitated or they will be irritated. Now, another important problem with the Asperger syndrome, that is they cannot imagine the things. This is a very important thing. So they cannot imagine things in the sense, if suppose I am telling something, so what the person sitting in front of me, what actually he will feel, they are not bothered about that. So they are very straightforward. So whatever is right, so whatever they are seeing, they are thinking that if it is right, they will start telling it. Okay, it may be embarrassing to the person sitting in front of him, so they will not think that, imagine. Okay, there is no actually imagination at all. So we can say no abstract thinking. Okay, no abstract thinking. Now, if you ask him to present the seminar on a gathering, suppose, now this is main thing. If you, this is the example I am giving. If you ask him to present a seminar in a gathering, suppose, he will be very good in reading. The slides are there, so he is very good in reading. Okay, so everybody will appreciate because that slide contains very good matter, because this person has got no any problem with the intelligence and all. So it contains good matter. But when the turn comes for question and answer, okay, so question and answer comes, so this fellow is not able to answer. This fellow is not able to answer. So because he cannot interact. The main problem in this disease is social communication or social interaction. He knows everything. He knows everything. He is good in the subject. Okay, it's not like that he don't know. But still, when he is talking to somebody, he feels very difficult to communicate. Okay, if suppose where is your home? If somebody asks me, for a normal man, it is simple. Yes, my home is in Jaipur or somewhere else. Okay, Karnataka, Jaipur, somewhere else, I will answer. But a Asperger's kid, when you ask where is your home, it is just like a mathematical question for him, question for him. So he think, what should I answer now? And he is totally blank. Okay, actually it is a very simple question, but he is totally blank. So with that, because of this, what he will do, he will not do any interaction. Okay, either he will shift to non-verbal interaction, okay, or he will keep quiet, or with difficulty he can tell the answer. So I hope you understand, this is the problem with the Asperger syndrome: social communication. Nowhere, no domains are affected: motor, fine motor, cognition, language, social. None of the domains are affected. Even the social developmental milestones are also normal, but the problem is only with the communication. Problem is only with the social communication. So these are some of the points of Asperger syndrome. We have got many interesting things about this Asperger syndrome, so that we will see in the part 2. Thank you very much. Don't forget to subscribe my channel, and please give your comments, and also visit the playlist. Thank you very much.